Okay, my name is Kim Baxter, and I'll be working on this presentation along with my counterpart, Sue D'Agostino. We're going to talk today a little bit about Meditech MPM, the clinical support staff workflow. Everybody has been placed on mute, and if you want to ask a question, just please click on the Q&A in the top right-hand corner of your screen and place your question below, and we will try to answer those when we finish the presentation today. All the questions and the answers will be shown with the slide deck on our wiki about 3 days after the presentation has completed. Also, if you can't see some of the writing or you want a full screen view, you just click on the little arrows here and it will open it up to a full screen view for you. Like I said, I'm Kim Baxter. I want to introduce Sue D'Agostino. She's an RN, Senior Clinical Analyst with Galen. She has over 20 years of healthcare experience, including 9 years in the EHR. I am a senior consultant also with Galen. I've got the same, about 20 years in healthcare and about 10 in EHR and practice management support. And my background is mainly clinical management and business office workflows. So what we're going to start with today is a brief review of Meditech and Muse. We're also going to review a little bit of, just a moment, my slides are not advancing properly. Give me 1 second to try to correct that. Okay, there we go. That's better. So we're going to do a little bit of a review of Meditech and Muse that's coming up. We're going to look at the different views of the patient schedule and where you change the status to start the patient visit. We're going to look at starting the visit from the clinical support staff perspective, like doing your intake, your history, review systems. We're going to work a few tasks at the end and messages from the desktop, and then we'll go over some questions and answers. So a little history on Meditech and MPM for those of you who are either new or just maybe an FYI for you. They're started off in the inpatient world and branched out into ambulatory with a product called LSS. They are a huge company that is global, and they serve not only physician practices and ambulatory care centers, they also do acute care hospitals, long-term care facilities, and they are not located just here in the U.S. Like I said, they're global, and with their largest markets in the U.S. and Canada and the United Kingdom. So as you can imagine, interoperability is a big thing with them since they have their health information management. They also do revenue cycle, emergency department. They even have cost accounting, general accounting, human resource planning, supply chain management, and all involved in the Meditech suite of options that you can get. So in 2001, they invested in LSS to work on the ambulatory suite. And in 2011, they fully acquired the product and named it MPM for Medical and Practice Management. And this is what we're going to be reviewing today. Depending on the version that you're on, some of the screens might look a lot like your other modules that you use. But we are going to be focusing and using a version Meditech 6.0 system. And I know many of you are still probably on the 566, 578 and looking to decide if you want to go all the way up to the new Web Ambulatory, which is awesome. But we're going to focus on the 6.0 today. So if you didn't know, Meditech has an annual conference called Muse, and the Muse conference is coming up in a little over a week. And we urge you, if you've not gone or signed up, to get registered. It's in Orlando. It's at a beautiful facility. And our own Stu DiAgostino will be presenting on chronic care management, or CCM, documentation within the ambulatory application. So we really want you to join us. If you don't know where to look that up, it's www.museweb.org to register. Okay, the next thing I want to show you is the interoperability. A lot of systems say that they communicate with other systems, and that's true, via interface of type. With Meditech, it is an interoperability in the true sense, whereas you don't have to log out, log into another application to see what's being fed over. All you do is click an icon, and here in the panel menu, the very top, you click Other Chart, and it launches you into the ambulatory, the acute care side of the application. So again, this screen might look familiar because the screens are very similar. So it's easy to follow from one side to the other because the similarity is there. All right, what we're going to start off first is to start any appointment, the patient comes in and they have to acknowledge them or arrive them at the front desk. They go through all of their registration updates and paperwork that they have to fill out. So there are several different places that you can change this patient status and start this visit. The first place, of course, is the scheduler desktop. The scheduler desktop is found under the administrative menu, under Scheduling Live, and the MPM scheduler desktop. And as you can see here, we have a patient view. And the way I can tell this is my patient view is, the patient at the top of the panel menu is highlighted white, so that means that's where we're located. And we have a search function for looking up a particular patient. Our test patient, Mario, has 2 appointments. As you can see, this is a test system, so they're old appointments. But this lets you see what type they are and where they're going, the location. Gives you a summary of the patient demographics, the appointment information, what insurance they're on, and the resource name. And you might have several resources down here if the patient sees 3 or 4 physicians in the same facility. And at the very bottom, and most of the scheduling screens, these are the very same buttons. I call them the footer buttons. You have display, which will, if you click on it, gives you options of changing the display that you're looking at. You can change the date, the range, the appointment statuses, the appointment types, the resource, and we call it resource because it might not be just a provider. It might be a service, physical therapy. It could be occupational medicine. It could be radiology, lab, so forth. So that's why they're called resource. And you can also create letters and forms from this screen. So if you want to batch print letters to your new patient or forms that they need to fill out for the patients that are coming in tomorrow, this is where you generate those into a queue and print them out. Changing status, we're going to go into that more, but that's exactly what it is. You're changing the status of the patient, who is up here is in an attended status. Duplicate, if you've got a patient pulled up and an appointment highlighted and you want to duplicate that appointment, what that does is it takes everything that's in that appointment except for the dates and lets you duplicate that. So if you have a patient that wants to schedule a full year's patient appointment and they come in every 3 months, then you can duplicate that everything going forward and you don't have to retype all of that information.
Hey, Kim, I'm so sorry
yes.
to interrupt your flow. We just had a couple people reach out to ask if you could maybe adjust your setting on your voice a little bit. There's a little bit of a muffled quality to it.
Okay, I will do that. Just a moment. Let me get that done.
Thanks so much.
How is that? Is that better?
I think so. The person who reached out, if you can let us know if you can hear a little bit better, that'd be great. Thank you. Thanks, Kim.
Okay. So follow-up is just exactly what it means. It means you're going to take this patient and schedule a follow-up appointment, a one-time follow-up for them. Times, this is kind of confusing. This does not mean appointment times that are available, which I personally automatically go to when I think that. When I look at that, it means that you're going to start timing this patient. So if your facility is looking at bottleneck points or just wanting to do an audit of how long it takes the patients to get from check-in to check-out, that is what this does. And it goes along with the statuses that are being used. And I'll show you in a little bit from the back end how changing those statuses triggers these times and follows this patient. So this is a very good tool, and if you are having complaints of things taking too long and you're trying to figure out where that bottleneck is, this is a great tool to use that for. Alerts is to put an alert here on the patient screen or any other desktop screen particular to a specific patient that maybe they need to update or you need to collect money or something like that. It's just an alert that you can put in on the patient. Health maintenance, this launches you into the health maintenance module of the patient to see if they're due for any health maintenance item. It's grayed out here from this screenshot that I have, but future appointments, it looks to see what future appointments the patient has. This is cut off a little bit. It is request and review eligibility. So there is a service that runs periodically, however, what time you set it for. A lot of places set it runs at midnight. That it checks for all of your patients the next day or 48 hours out to check the eligibility of their benefits that's currently in the system. If you make an appointment after that run, then you can request an eligibility on the fly. If you want to review what the previous eligibility was, that last one that ran on the patient, then you click the review eligibility and it will show you that. Okay, now option 2 that we're looking at the schedule is from the practice view. So when you're signed up, and you can change what you're looking at, but by default you're given in security a particular practice that you default to. This will show you for the time that you've requested, whether it's 1 day or 2, everybody in that practice. So as you can see here, there's nurse, there's procedures and things like that. So it's not just a provider view, it's the whole resource that's in the facility for that time frame that you have chosen. And it gives you all the patients. You can also change the status here as you see the button. It gives you a visit reason and an appointment confirmation if you place to put confirmation if you call and check with the patient and confirm they're coming in. It also allows a visit comment. This is where they put sore throat or what have you that you can add to that as needed. Again, down here at the bottom, you've got all of these buttons that gives you the option to do multiple things. Now, from the back end, let me back up one more thing. As you can see over here to the left, to the right, we also have appointment book, and this is just like opening up an appointment book and looking at it. Literally looks very similar. Resource means if you want to look at one provider or one resource schedule at a time, it will let you look at that particular resource for that day. A wait list is anybody that's on a wait list. Maybe they got bumped from an appointment because you had to cancel patients. So it puts them on a wait list for you to work and reschedule. And meeting, this is if you need to schedule a meeting and block a calendar for meeting times, and that's what will let you look at that. And you can see many others. We're not going to go over those because we're trying to do clinical support, not front desk support. So from the back end, and most of your clinical staff will be viewing everything from this method. So from the patient visits, from the schedule, from working their work lists and tasks, starting notes, everything that the clinical staff pretty much does will be done from here. So you have your clinical menu at this time, provider workload management, or PWM, and physician desktop. The first thing you see when you log in here, it takes you to either the desktop or the practice schedule. This particular user that we have set up defaults to this. Most of the time, you're going to default to your desktop. But you have your practice schedule over here, and again, you have footer buttons that give you options below. You can schedule an appointment from here. It will launch you into a window to schedule appointments. It also lets you look at your list. So if you have a work list that you've created, it'll let you do that, and it'll let you change your cover selection. So again, according to your security, you will be built to view a particular provider, but let's say they ask you to cover providers, then you can do a coverage selection and change it for that day or that while you're logged in. When you log out, it'll go back to your default, so then you'll have to reset it. But at least for that day, you have an option to change your settings as needed to look at the provider that you're covering for. Okay. Then when you push schedule appointment on the other screen, it takes you to a window to schedule. Now, let's say you're in the throes of your visit and you're deep in the chart and you want to look at scheduling an appointment for that particular patient while you've got them in, and you don't want to have to go out and go back to that other menu and all of that. Well, while you have, as you see, I've got a patient in context here, and I've over here on the right, I've got options. Down here, you've got administrative. When you click on administrative, you're given this screen. This screen is your routines menu, but it also does reports, and routines are another word for what I would say workflows. So as you can see, the very bottom one is schedule appointment. So you highlight schedule appointment and you click process. And what that will then do is take you to the scheduler's desktop view. So it's kind of like a little shortcut. It'll launch you into this view for you to move forward. So at this time, we're gonna take that appointment that was booked, and we're going to change it. And the options that you have from the scheduler desktop is either canceled, no-show, or attended. Because the front desk normally does not do anything else with the patient. They either arrive them, they either no-show them, or they cancel the appointment, or they book it. So it's going to be in a booked status. You're going to change it to one of these three. So for this, you would click the change status below, and you'll change it accordingly. From the practice schedule in the provider workflow, desktop workflow, you have the status right here. So this is kind of tricky. It took me a little while this very first time I ever logged in how to do this because it was not intuitive at all, and I had not worked in it but just a couple hours, so nobody had told me this yet. The status is actually a hyperlink. So it doesn't look that way, but it is. And if you click on status, it will give you this box. Now remember the times that I told you about. If your company has it turned on, the feature turned on, then as you move through these statuses throughout the patient's visit, it will log a time. And it'll track that patient through all of these statuses. So it's important that if they're going to do this, that you actually hit these statuses as you move the patient through. So to go over those real quick, of course, attended means that they've attended. They're there. They're at the front desk. They're checked in. When you pull the patient back, you will then arrive the patient. And down in the comments, I'm sorry, I'm talking ahead of myself. When they attended at the front desk, it automatically to the back end changes it to an arrived status. When you take the patient back, you're going to change it to roomed when you put them in a room. And down here in this comments is where you can put what room you have the patient in. You have them in triage. You have them in room 6. You have them in prep room, whatever your workflow is in your office. Once you've roomed the patient and you've done your intake, then you will go to the next one here, which is nurse cleared. NC means nurse cleared. So that means the nurse or the MA that checks the patient in and begins their visit has done everything they need to do by protocols, and they're ready for the provider. Another neat feature about Meditech is there is a setting that once the patient has been changed to NC, and this is per provider, it will send an alert to whatever computer they're logged in at the time and tell them your patient in room 6 is ready to be seen. I've seen some physicians use that and some not. Like I said, it's physician-specific setting, so it's not system-wide. It can be turned on for one and turned off for another. And seen means the provider has seen the patient and they're ready to be discharged. If the patient is seen but the provider's letting them go and go on out, then, you know, he can put in here sent to checkout or something like that so that, you know, you don't have anything to do. The patient is gone. Departed is mainly the checkout desk, wherever that's done, whether it's done in the back in your pods or if it's done up front with a checkout person. That's when they'll mark it departed, is once they've completely done the whole checkout process. If you want to change the comment, maybe you move the patient from room 6 to the lab waiting area because they're going to give a urinalysis for low back pain before they see the provider. Maybe they're not roomed, but you have roomed them, but they're not cleared yet by you, so you're going to leave it in a roomed and put lab waiting area. Then when the lab tech takes them back to the room, she'll put the room number back in so that you know your patient's back in the room. So next I'm going to turn it over to Sue and let her take you through an intake. And Sue, are you there? Sue? Oops, you unmuted.
Hello.
There you go.
All right.
Hi there.
Hey. Bear with me just a sec while I share my screen with you. Can everyone see my screen now? All right.
Yes.
So, thank you. Good afternoon, everyone. So at this point, the typical workflow would be that the nurse or medical assistant would open the note and start the intake of patient history, vitals, special forms, and in some cases, the review of systems. This would be done by clicking on the pencil icon in the patient schedule. a window would pop up and the note template options available for that user would be listed. In the example above, the user has made a specific template a favorite. However, if this was not the appropriate template, the user could select the All button, and then they could search for the template that they needed to use. The nurse or MA would then click on the intake section, or as Kim and I so lovingly call them, bubble, to start the visit. Now, as you can see in this template, the chief complaint does contain a text field, but when you click on edit, you do get a defined list with an option to add a chief complaint. This list can be edited on the back end by your system analyst via the APR dictionary's chief complaint. Now we'll start moving through the intake. We're going to start with the allergies. When you click edit, this will take you to a separate window where you can add, update, or remove an allergy and assign it an adverse reaction type and severity if indicated. The vitals, clicking on edit will open the vitals panel, just the same as if clicking on the chart section on the right of the documentation screen. Different vitals can be defaulted into the section as your facility chooses. Next, we have medications. With an at-a-glance view of the meds is available, and if there are no changes, there is an easy reconciliation checkbox within this space. So there's a lot of pretty cool little things that are available in MPM to help make workflows move pretty quickly and easily for your users. We also have tobacco use questions for meaningful use, PQRS, and other measures, as well as other miscellaneous items that your facility or providers may desire to be answered upon intake. Next, the PFSH captures the medical history on the patient. By clicking on the blue hyperlinks, you'll open a secondary window that allows for each section to be updated. We're going to update the family history section. We can document each family member and add a family relation if needed. We can also add conditions if needed. Within each section, there's a checkbox where you can check that the section was reviewed. Once all updates are complete, then the update selected sections as reviewed should be checked. Once the nurse has reviewed all history and completed their intake and other sections that they're responsible for, they would then save as in process and then turn the patient over to the provider. Now, depending on clinic or organization workflow, in addition to the documentation of the patient intake, the medical assistant or nurse may also be responsible for documenting the patient review of systems. The review of systems is generally made up of queries or questions with yes/no responses. There is also free text boxes, comment areas available as needed for additional information that the structured responses may not cover. Now, one thing, before we really dive into documentation, we need to talk about a very important workflow that involves the desktop and task list management. The desktop is the first thing that staff sees upon logging into MPM. It's the task list. Any patient, physician messages, results, prescription renewals, and so on will show here. Also, you'll see the watch list. Whoops, my little task buttons are getting excited to show for you. But before we get there, I do want to talk about the watch list. Watch lists are where tasks on the patient that are not assigned to the logged-in user to complete live. The user can take action on these, but they're assigned to someone else. So they could be tasks that are assigned to the provider, for example, that the user may want to monitor to see what's happening, but that user is not responsible for those tasks. And honestly, they don't have to do anything with that watch list if they don't want to, but they do have access to see what is happening with those tasks. So back to talking about the desktop. Best practice for desktop is to monitor throughout the day, especially first thing and at the end of the day. Some organizations may have a written policy or procedure on how often your tasks or desktop is to be attended. Each organization is different, however, and will follow a different mind view when it comes to the particular workflow. So back to our buttons. Let's review some of the functionality of the desktop buttons. Now that I can click and the cover can show itself again. So when the user wishes to see the tasks of a user that they're covering, they would click that cover button. Cover selections allows the user to select the user that they wish to cover or monitor tasks for. Clicking the Cover Selections button will open the Cover Selections window so that the user can select the coverage user or group. Now, as you can see, the user has the ability to select provider groups, work groups, or individual providers that they wish to cover. By typing a few letters of the provider's last name or group into a search bar, it brings up the name, and the user then clicks on the correct name and clicks OK. Now, some of you may be wondering, why are we talking about the desktop and tasking in the middle of the patient workflows and documenting a patient visit? Well, as is in the life of a clinical support staff, some days you do what you have to do when you can. And that means checking your desktop and working your task list when the opportunity presents itself. And as a nurse, I've had to do it, and some of you who are out there today know that you do what you can when you can. And Kim will be getting more into task management when she reviews the ambulatory checkout tasks later on in the presentation. But what we're going to do right now is take a closer look at documentation. And as support staff, we do need to document and understand the functionality of the buttons within a template and what the hyperlinks are for as well. So to begin documenting, we can click on the Edit Amend button, or we can also select a blue hyperlink, and that will bring us right into that particular note section. We also have the ability to just scroll right down through the note in the event, again, that we want to just jump right into a particular note section. So if we just wanted to jump into our review of systems or into a physical exam section or HPI, we would just scroll right down and then hit that hyperlink to bring us right into that particular section. And while we're here, this format that we're looking in right now is the format of how the actual visit note is presented within the actual patient chart. So let's look at our template. The bubbles, or the real word is sections, that you are documenting in, at the top of the template, excuse me, the sections at the top of the template, let's start over, are always are at the top of the template sorry, I'm tripping over my words here. These are the note sections at the top of the template, so your physical exam, your HPI, ROS, and so on. The section bubble that you're going to be documenting in, here we go, is always going to be white. So anytime you have clicked on a section, it's going to be white, and that's how you'll always be able to know which section that you're in. The bubbles at the bottom will start talking about normals, allow us to add our normals to the review of system and physical exam section of our note template, and then the provider can go back and document by exception. Now, of course, we wouldn't be documenting in the physical exam. We would just do, some of us would do review of systems, and we would use normals for that. And an example I would use would be physical exam constitutional that a provider may have, well-developed, well-nourished, and no acute distress, maybe a normal. But if they have a patient who's coming in for an acute pharyngitis, that patient is probably having some distress. So the physician, when they were documenting by exception, would go back and change that to well-developed, well-nourished, and in acute distress. So that would be an example of documenting by exception when using normals. Next, we have for our buttons at the bottom is add or remove a section. This functionality can be used if staff knows a provider wishes to use a different physical exam, for example, than the one that is in the template in use. Or maybe this is a candidate for chronic care management. And if that's the case, then you want to pull in the CCM section and begin this type of documentation. Now, keep in mind that if you're adding a new section, such as a review of systems or physical exam, that best practice would be to make sure that you do remove the section that the provider did not want to use, because then you do end up with multiple sections. And those do end up showing in the note as well. So you do want to remove the sections that you do not move. Next, we have clear responses, and that is pretty self-explanatory. This will just clear any responses documented in the section. View protocol. Protocols are clinical treatment plans that are associated with documents. In order for the View Protocol footer button to be activated, the protocols must be attached to the template via the Ambulatory MIS Physician Documentation Template Dictionary. Next, we have Preview. Preview just allows the user to see what the actual visit documentation will look like in the patient chart. Code Visit. This opens the code visit window to allow the provider or user to enter in their level of care for the visit. Repeat, if the query has been built to document multiple instances of an issue or problem, selecting the repeat button will highlight it on that multiple query will automatically repeat the query in the next sequence. So an example of use for this could be if a patient has 2 lesions and the physician wants precise documentation for both lesions and wants to differentiate between lesion 1 and lesion 2, they could use the repeat functionality to perform this action. Next, we have save as in process, and this will just save the note as an in-process status. And this just means that the user can go back to the template and add or remove documentation if needed. So the cancel and save buttons, if cancel is selected prior to the note being saved in process, the whole template will be canceled. If the template has been saved and the user enters documentation and cancels, the additional documentation will be canceled, but the original documentation will stay intact. Selecting the Save button provides several options for the template. We can save in process or select one of the following. Draft only allows the addition of documentation. The user will be unable to remove documentation. Signed will sign and finalize the note template. If anything is to be added, it will become an addendum. Canceled is used to totally cancel the note, but can only be used and is only available if the note has not yet been signed. We'll talk a little bit about CPOE, or computerized physician order entry, and how that is performed in MPM as clinical support staff. As I'm sure out there, you know, clinical support staff do end up doing ordering, so we are going to go over some ordering. You can access the orders module from the panel menu, but we'll be demonstrating the orders workflow through documentation today. Once we're in the plan section, we can begin entering orders. Best practice is to add problems prior to adding the orders. By adding our problems first, the ordering process will be a little less cumbersome. The ordering process in MPM can be, and I've heard, and you've probably heard as well, it can be a little cumbersome. Once you've done it enough times, it does get easier, but the first few times, especially with providers, it can be a bit of a process. So once we click the Add Problems button, the Problems window will open. We type in the search bar to find our problem and either click the magnifying glass or the Enter key of our keyboard, and then check the box next to the appropriate diagnosis. Once all appropriate diagnoses for the encounter have been selected, we click Save, And this will bring us back to our plan where we would then click the Add Orders button. Once we have clicked Add Orders, the ambulatory order management screen will open. At the top of the screen, you'll see any current prescription and diagnostic testing that have already been ordered for the patient. This allows for easier access of the patient's current orders to avoid duplicate ordering. However, a patient with multiple medications could take up a great amount of ordering workspace. So, best practice would be to minimize the current ambulatory orders to enable a larger workspace to enter in today's visit orders. Very often, especially during the first few days of a go-live, I constantly remind the providers about that minimize button. When you have a patient, especially an elderly patient with, 10, 20, 30 medications who's, taking up a lot of space and there's a lot of scrolling going on to get to where the ordering happens, it takes up time and providers get a little frustrated. So just, giving them a quick reminder, hey, use your minimize button to get there quickly. It's just a little hint, and it helps them. It gives them an extra, couple of seconds to click that minimize button and, oh, okay, there's my order button, there I go, boom. Okay, so to order a diagnostic test, we will select that orders button. And let's go through some other buttons, too, that are available to staff as well as physicians. We've got our meds button, so we would search on the meds to add medications to the patient orders. Sets will show the user order sets that have been saved either by them or by the organization to drive ordering practices. Favorites provides the user with a list of their favorites. Category, by selecting the orders, meds, or sets, then also selecting category, users are able to narrow down a search. And I'll actually, I'll show an example of that on the next slide. Next, we have name. When typing the first two letters of the name of an item, you'll get an alphabetical list of matches. So this can be helpful when you're just not sure of the spelling of something. So you just, type in the first few letters of something and you'll be able to get a list of what it is you're looking for. Next, we have function. Interaction and conflict checking can be triggered manually via the function button. These are based on parameters that are defined in the MIS Interaction Conflict Checking Dictionary. Undefined medication and medical equipment are not included in interaction and conflict checking, so keep that in mind. External medication history adds patient's external medication claim history to the patient's record. There we go. Category. As mentioned in the previous slide, category does allow users to narrow down a search by selecting the orders, meds, or sets, then also selecting category. As seen in this example, the user has chosen orders and category. Therefore, you see headers of the different types of orders and categories available. And a very common use for this is for referrals, procedures, and with medications for DME or supplies. All right, so let's get back into our ordering workflow. To search for an order, we would type in a few characters, check the box next to the correct order, and then enter in any required information. If this was the only item that we need to order for the patient, we would click the select button and then save. But in this case, we're also going to be ordering a medication. So to order a medication, we would click the meds button, and as with the orders, if there were any favorites saved, the system would be defaulting to our favorites, just like with the orders. Otherwise, we would be searching for the medication name. We click the plus sign next to the medication name to open the available options, and then check the box with the appropriate dosing. Best practice is to click in the details column to open the change details window. This will assist with easier editing access, especially for older docs The ordering area can just be a bit messy and jumbled, whereas the change details window is just much neater and easier to see. You can also associate the diagnosis with the medication being ordered so that it falls under the correct diagnosis in the plan. And you can just see it's just a little bit, it's kind of messy here. And sometimes, like I said, with older doctors, it's not always very intuitive to see exactly what you're doing here. Whereas in here, you can see a little bit better what you're filling in, and then you've got your diagnosis here too. So it just, I always tell my doctors to just get right into that details window so that they can see what they're doing, and it just tends to work better for them to do that. So once the medication SIG is entered, they would then click Save, and that would be ordering a medication. Now, at this point in time, y'all can kind of stretch. Bear with me for just a minute while I hand things over to Kim. I just need to find screens again. You know how it is with everything when, there we go. Everybody stretch while Kim will be going over checkout and ambulatory tasks momentarily. Kim, I can't hear you if you're talking.
Are you, can you see my screen?
Yes, and I can hear you now too.
Okay, all right. Depending on the workflow in your office, the role of the person responsible for checking outstanding tasks before the patient's departed might vary a little. But what we're going to do now is, let's say you're going to do the checkout tasks that you might do in the back, like giving the patient a medication, or making sure something goes to the lab properly, or even printing off education for the patient and going over it before they leave, or any kind of discharge instructions. So first we're going to look at what the desktop looks like. So like I had said in the very beginning, depending on your role and how your system is set up, when you first log into the provider workflow management, you'll either come to a desktop view or to maybe even the practice schedule. So here we're looking at the desktop view. And as you can see, we have messages, incomplete, referrals, and orders. So incomplete might be a message that, or an order that was trying to be done and didn't get completed all the way, so it's going to sit in an incomplete status until it's finished. Messages are going to be things like the front desk maybe is sending a message back to you for a patient call. And of course, referrals are referrals that need to be processed. And depending on if you're the receiving or the sending referral person, the referrals and the incompletes kind of go hand in hand together. That's a whole other presentation along with some of these other messages, so we're not going to get into that here today. But at the end, we'll give you a web page and address to submit your information if you want to see something else. Be sure and give us some feedback. Let us know what you liked, what you didn't like, and if there's other things that you would like to see. So as we're going through this, keep that in mind. So first off, we have, we're going to start here in the orders, because that's the first thing you're going to check before you let the patient walk out the door. And we're going to look at a follow-up appointment, as we have here. So it's under orders, and it's follow-up appointment. Then what you'll do when you click on that task, pardon me, it's not wanting to click, there we go, is you'll get another window, and as you can see, this looks like maybe a written message that we used to have a little message pads that were carbon copies and they had certain places you put everything. That's what this reminds me of. You've got your patient contact information at the top, your preferred phone numbers here, an address, and as you can see, this can be edited on the fly if you need to update the phone number where they can be reached. Priority, this can be edited to urgent, ASAP, routine, different priorities here. Then you have what this task or this message is about. So it's saying this is an office procedure needing to be done, follow-up appointment in 2 months with this health center. All right, so our options here, for some reason this is crossing over, so ignore this down here. It normally wouldn't be there. We have a process, task, or a list. So if you click on list, it's going to take you back to this list here. Process task is what you're going to do to take action on this task. So we're going to process this task. All right. It takes you here to ambulatory order management. And this is a list of this patient that the task is on and any outstanding tasks that are still active on this patient. So what does that mean? Well, when you make a follow-up appointment, you're not going to do it in an order window. You're going to do it in a scheduling window. So it doesn't take you into the scheduling. It's going to let you go out, do your scheduling appointment, then come back in here, and once you've scheduled it, you click on Verify. So as when we processed it, it turned it into a Verify function. When you make that appointment, you click on Verify, and then all it does is change it to complete and takes it off your active orders list. Okay? So then you would save or go to the next order that's pending on that patient. In our list for today, we've also got a overdue ambulatory order. Well, that could be all kinds of things. So what we're going to do, and well, let's go back. So we've got the checkout ambulatory and an overdue ambulatory. These kind of are the same thing. It's just if this was done on a checkout process or if this is done because it's set in your queue for a certain period of time, it could be similar. But there's also some workflows where it's automatically going to do an overdue status if it's not done right away. So again, we're not going to go into every single one of these. I don't want to take up that much of your time. But let's click on the one, and it's saying that, again, you've got your header up here. This is a clinic process. So this is an medication administration workflow. I'm getting tongue-tied, Sue. You're contagious. So we have a Recefin injection that needs to be given today, and the instruction is over here as to what we're going to do. Down at the bottom, and I don't have a screenshot of that, you've got another process task button. We're going to click on that. And it's going to take you to a window that says, okay, to process this task, what you have to do, the action you have to take is administer. So you're going to give the patient and you're going to document that you gave it. So again, once you give the patient this shot and you click on the administer, and I apologize, my screenshot's not coming up, but it has a window that lets you put where the route and the lot number if it's not defaulted, and any of this other pertinent information, expiration date, a lot of that stuff will default because you've got it in there for your batch of medications that you've checked into your system. But if it doesn't default, then you can free text that in. Once you've filled that out, then you'll say save, and it changes it to a complete status. So there is your completion of that. and it'll drop off of your work list on your desktop. So now the next order we're going to look at is the incomplete ambulatory order. So the incomplete is basically the same thing, that you've put in an order, but there's something preventing it from going on through the system. So we're going to again click Process Task. And again, you can see this is a rapid strep to be done today. So you've done the swab and you're going to go in and you're going to result. So when you have an incomplete ambulatory order, it's going to ask you to put in a result on this particular one. So that's your action for this task. You click Results, and you're given a window here to put your results in. So if this was a urinalysis, lines 1 through 10, or however many components in your UA that you need to complete, results will be in there. And your result in this box is either going to be a drop down or a number to type in or a free text field for comment or whatever, however it's set up in your system. So for this one, we're putting it as a positive result. And if you need to make a comment, you've got your comment over here. You'll click Save, and then that will be gone out of your task list because it will complete. We have one more, which is the lab checkout order. So the lab checkout order, again, means there's some action that needs to be taken before this test can be considered complete. This is on a urine culture. So we click on the actionable item, which is the required queries over here in the yellow, and it brings up what's missing. It's asking you what the specimen source is. So that didn't get answered on the order entry, so we're going to enter where the specimen source came from, and then it's going to go to a process, which means it's went on through the interface now and it can be processed. Again, it will drop off of your work list until it's ready to be resulted or verified by the provider. The results are verified. Now, the next step in checking the patient out from the clinical support staff is making sure the patient has any paper documentation with them that they're going to need, whether it's a referral form to take to physical therapy, if it's a printout of some stretches for them to do for their stiff muscles, whatever. I'm not a nurse, so I'm kind of winging this, but anything education-wise or instructions that you need to give the patient to take home. Also included in this is the clinical summaries that we need to print out to send with the patient for meaningful use and for many other things nowadays that also come off of that. For instance, CCMH requires you to give the patient the summaries. So this is the process that kind of finalizes all of that. Everything might be queued up and just given, and the front desk prints it all out at one time. However, if it's an instruction, the nurse might need to print it out and go over with it, the patient with it before they leave. So we're going to take that perspective and kind of look at what we do. So from the front desk, the scheduler desktop, if they're going to do their piece, then it, again, from the scheduler desktop, and they will have a little button here that says check in and out. So they would click that, and it would take them to the next screen. From the provider desktop workflow, as you can see we have here, we've got a patient pulled up. We're looking at their summary, which is this button right here because it's white. But we want to check them out, so we're going to go down here to the panel menu on the bottom and click Check Out, and it's going to take us to Select Encounter. Now, the reason that the scheduler desktop doesn't do that is because they've got the schedule up and they're highlighting the appointment on the schedule and clicking Checkout. So it's already linking it to that encounter, but from the back, the patient might have several open encounters. Maybe they've gone to 3 or 4 different facilities in the last week, or maybe they've even had 2 visits within your same clinic on the same day as this one has. So they had a lab work done, and an office visit. So you want to check which encounter this summary or this instruction or education piece is going to come out of. You click OK, and then it'll take you to the checkout screen. As you can see, this is checkout material, and it has visit summary and immunization history. So for this particular facility, their system is set up. These are the two things that it wants to automatically give you the option to print when the patient leaves. Visit summary is all automatically checked because we want to make sure every patient gets their summary. If you are the nurse in the back and you're wanting to do this, you want to add a patient education, you've got patient education add down here at the bottom in the footer buttons. And you also have a print button. So once you add everything you need to add, anything that's checked will print when you click print. So we're going to do an add patient education, and it'll bring us to a search screen so we can type in the search, or if you know, you can go to the next screen, or you can change category. So if your education is listed under different categories and you know what that category is, you can change the category appropriately, narrow down your search a little bit. So let's say the patient that we're looking for is an OB patient that came in because of some pain today. So you're going to give them some education on false labor so that they understand the difference between real labor and false labor. So we're going to search for that. When we see it on our list, we'll highlight it like this up here. And we're going to add it to our list of checkout material. And as you see, it's checked. So at this point, if I print out the visit summaries, I could just hit the print and send it all at the same time. However, I want to only give them the patient education. So what I would do then is uncheck visit summary and do my print on patient education. Then when the front desk does their checkout routine, they will recheck the visit summary and make sure it's given to the patient. All right, so that is all of our presentation today. We're going to check real quick and see if we have any questions that haven't been answered. Sue, do you see any at this time?
Yeah, it actually looks like someone would like me to go over normals again, and I can certainly do that real quick.
Okay.
Can you just pass over, I guess I need presenter again real quick?
Absolutely.
And I can do that. And normals, again, normals is just a way of setting up a quick way for the provider or users to document. Some organizations don't allow normals to be done. It depends on your organization as to whether they allow normals to be used or not. It's set up on the back end. Your analyst will set it up, and whether you get, it's an organizational setting. And then, do I have it now? Can I show my?
Yep, you should. Yeah, you should have it.
Yeah, you're right. Yeah, you're right. Hold on just a second. Let me get my monitor.
TGIF, right?
Yeah, exactly. Exactly. Okay. So unfortunately, I don't have a slide that actually shows normals. So maybe another webcast that we can do can delve more into documentation, and we can actually show normals. So all I'm really showing here is the button that we would click on normals, and it would, all I'm showing though is that it allows us to add normals to our review of systems and physical exam sections of our note template. And then what happens at that point, once the normals would fall into the section, the user can then go back and document by exception. So each of those areas of the section. So say we were in our physical exam section. So each body part system, each system of our exam would have, each physician knows 80% of the time what their normal visit is going to have. So for their constitutional part of their visit, normally they would document in a normal exam, well-developed, well-nourished, in no acute distress. 80% of the time their patients are well-developed, well-nourished, in no acute distress. But if they have a patient who is coming in for, the example I used previously, they're coming in because they have a sore throat, an acute pharyngitis, that patient is probably in some distress. So, their normals, once they've had their normals documented, they would then have to go back and they would have to document by exception. They'd have to go back and change that in no acute distress to in acute distress. So they'd have to go back and document by exception. And of course, there would be other parts of that exam. In the different parts of their exam, they'd have to go back and probably, in the throat area, they'd probably have to change the tonsils to showing some exudate and things like that. So they'd have to change, different parts of their exam based on the individual patient for their normals. So that might be something that we have to do in another WebEx, maybe getting deeper into documentation to show things like that.
I think that's a great idea. Okay, it looks like we have another one, Sue. Can a form be scanned into MPM and used? I've not seen a form be done like that. Have you?
I don't think a form can't be scanned and used. We can build something and use it. Like we could take something that you used in your clinic and build it to be, used, but you couldn't use it like a PDF or something like that, no.
Right, or a bubble sheet. I know some systems, when you scan something in, it makes the field interactive, but no, we can't do that. But we can try to, we've recreated some neurological testing forms and certain things like that we could definitely get us very close to. Because you can build in imagery and things like that where you can mark things on the patient and with different markings and like you would on a form in some instances. And can a message be forwarded if it goes to the wrong nurse? Yes, it can. And the second part to this question is, what is the best workflow? Okay, I'll do this one. So when you, and we don't have a slide on this either, like I said, messaging and working every type of task, referrals and everything could be a whole webcast in itself. But when you create a message, the footer buttons at the bottom, when you open that, click to process that message, at the bottom you've got footer buttons. One of them is route. You can route that elsewhere. Forward, you can forward it. That's an option. So if you're forwarding to a particular person, the route might be to a particular queue for like front desk work queue. That way anybody at the front desk sees it. Forward will send it, you can send it specifically to a person. You can create a letter out of a message, or you can just read the message and close it. So there are a few different options. One thing that you need to keep in mind, though, is you can only edit non-forwarded notes on the task screen. So if you're needing to edit that message, you want to do it before you forward it. You don't want to try to edit it afterwards. So, and the message will appear as you follow it. So if it gets forwarded to 3 or 4 different people, you'll see in the message text area where it's been moved around in reverse chronological order with a timestamp indicating who the user was that entered that text or made that last action. or previous action. So I hope that answers the question. If not, let us know. And Sue, if you're still showing, I just wanted to show one more thing. If you could bring yours back up again, the last slide where it has our address where they'll be able to find the slides.
Sure, let me get there.
I could have just had you refer it back to me, I'm sorry.
Woo! Here we go.
Okay, so as you can see, the slides will be posted, and this is where you will find the slides, is the http wiki.galenhealthcare.com and category webcast. If you want more information or would like to see anything else on a webcast, go to galenhealthcare.com and go to About, and there's a Contact Us link, as you can see in the slide, and give us some feedback on what you would like to see or what questions you might have. And we hope everybody has a great weekend, and we're going to let you out of here, and thank you very much for joining us.
Thank you, everyone. Have a great weekend.